Next, the number of people newly diagnosed with HIV in the capital remains high compared to the rest of the country, despite advances in treatment, education and awareness. That's according to a new report which also found that black women are at a greater risk of getting the virus than the rest of the population. In London, nearly 1,000 people tested positive for HIV in 2023. Of those, almost a quarter, 229, were black women. A number that's doubled in 3 years. We'll hear from the report's author in just a moment. First, some Londoners have been sharing their experiences with our reporter, Thomas Magill.
Determined to smash the stigma around HIV.
They're like, take us for a walk.
Liswana was diagnosed in 2003 and says as a black woman she found it hard to get the right support.
When I was first diagnosed, the options were for gay men or African communities, and I don't fit into any of them moulds. It's always been a thing that there's nothing revolving around my culture as a Caribbean woman. So we've just chugged along, and I can understand why it's on the rise with black women, because they see that it doesn't affect them.
And that's why the Phoenix Health movement was set up last year. It helps black women living with HIV and other health inequalities. Its co-founder says there's a huge problem around education, awareness and stigma towards HIV.
We're certainly finding that for lots of women, particularly black women, they just don't think that HIV is something that affects them. They think it's, primarily gay men, so they're less likely to test. Quite a lot of the problem is that services aren't targeted for black women, information isn't targeted, and also in relation to testing, going to sexual health clinics, lots of women aren't really comfortable about that. So we need to make sure that testing for HIV are in places where women go.
And that's exactly what's happening here at this pop-up nail bar in Peckham, which offered treatments, informal advice and free HIV kits to customers, something everyone welcomed.
What I like about what's happening here today is a safe space that they create at the heart of Peckham, in the Peckham Palms, serving our Peckham community. I came over and collect my kits, I'm going to get tested and I'll follow up, whatever the outcome may be.
I think it's quite stigmatised, especially within my age group. A lot of people don't really know too much about it. So, I think it's positive,
Testing in communities is nothing new. Paris has run outreach clinics in cafes, clubs and civic centres in London for years. Today she's in Merton and says people feel more comfortable being tested in this type of environment.
The stigma is still there about going into a clinic, especially from an ethnic minority. They're frightened that sometimes, unfortunately, they may know somebody that works in the clinic, and that's one of the reasons why they're not going in there.
And it's not just black women where there is currently a rise in HIV rates, which is why outreach clinics like this one is so important in reaching communities and people at risk.
We really know that HIV and sexually transmitted infections is on the rise, particularly amongst heterosexual people in London and particularly ethnic minority people. If we find them in somewhere like a library or a cafe or a barbershop, we really hope they'll have more trust and confidence in our outreach workers.
Nowadays, Liswana is a busy working mum and also helps educate others that HIV is no longer the death sentence it once was for so many.
I now work in healthcare. I will eventually train to be a midwife as well as a nurse. But my favourite things to do is to make sure that other women are aware that you can live fabulously with HIV.
Liswana there. Well, let's pick up on this with Mark Thompson from the London HIV Prevention Programme. Really good to have you with us. Liswana saying there that she understands why it's on the rise in the capital, not just among black women. People might be surprised by that.
Yeah, I mean, we have seen a rise over the past few years in new HIV diagnosis in London. Primarily those is driven by inequity and inequality. That we know that particularly for women, it's harder for them to maybe get to clinics. Many women may not feel that they're at risk of HIV, and therefore sometimes getting hold of a HIV test or accessing HIV testing may not be as straightforward as it is for some communities.
Hence, as we heard there, bringing it to places that they might be. Now, it used to be that testing for HIV was a long process. People left in limbo for weeks waiting for results. But we can show viewers, can't we, how much simpler it has become. Just take us through.
Yeah, so this is a self-testing kit. It's really straightforward. Somebody will take a finger prick, draw a small amount of blood, put it onto a device, and they can get the results within 15 to 20 minutes.
And how long did it used to take?
Oh, we could take up to 2 weeks to get a test result.
Yeah. And do you think that this is the reason why perhaps more people have come forward, and perhaps the rise is because more people are being tested?
Absolutely. More people are getting tested. We have more opportunities for testing. We have opt-out testing in accident and emergency departments as well. So enabling people to access testing and understanding that testing is free, easy, confidential is the way that we should be going.
We also heard there in that report still some stigma, for example, around going to clinics, but also there are some misconceptions around living with HIV still.
Yeah, absolutely. There's lots of out-of-date knowledge around HIV. There's some recent research that 70% of people living with HIV have experienced stigma in the past year, and sometimes in healthcare settings. So if we can attend to HIV stigma, that will reduce some of the taboos and some of the barriers to enable people to come forward and get tested.
Are you feeling optimistic?
Absolutely, but we need to keep the pressure on, and we need to ensure that we can put testing into community settings like the Tips and Test event to make sure that our communities can get testing when they need it.
OK. Mark Thompson, many thanks indeed for coming in. We really appreciate your time. Thank you.
Pleasure. Thank you.
And we also appreciate that for some, this can be a difficult subject to talk about. So if you or anyone you know may need advice or support, the BBC has pulled together a list of organisations who can help in confidence. Just search BBC Action Line.